You're still watching Good Morning Nigeria on the network service of the Nigerian Television Authority. And of course, we are live from our Abuja headquarters studios. It's a pretty wet morning here in the nation's capital. Now, before we commence our conversation, of course, which is on the COVID-19 Delta variant, which is now said to be prevalent in at least 100 countries, let's join our correspondent, Joseph Otsen.
Just when the global community thought it is making headway on COVID-19 with the production of effective vaccines, the world has been taken aback with the emergence of the COVID-19 Delta variant. Countries like India, Brazil, Turkey, and lately South Africa have all fallen to its devastating effects, with some recording hundreds of deaths daily. Nigeria imposed travel restrictions on these countries as part of its preventive measures and has sustained routine testing at entry points. In spite of all this, the Nigeria Center for Disease Control, Thursday, 8th of July 2021, sadly confirmed the presence of the highly transmittable COVID-19 SARS-CoV-2 Delta variant in the country. NCDC says the variant was detected in a traveler to Nigeria following the routine travel test required of all international travelers and genomic sequencing at the NCDC National Reference Laboratory. What's disturbing is the fact that the variant is said to be living in the country for over 2 months before it was detected. The WHO has attributed spike in COVID-19 cases in over 100 countries across the world to the Delta variant. Unfortunately, Nigeria has been reporting increasing cases this month, especially in Lagos. For instance, NCDC reports show that on the 6th of July, Nigeria recorded 91 new cases, on the 7th, 110, and on July 8, 2021, 146 cases, making a total of 347 new cases. Out of this number, Lagos topped the chart with 264 confirmed new cases. Meanwhile, as of same time last month, Nigeria was consecutively celebrating no case of COVID-19. But with the confirmation of a case of Delta variant in Nigeria, how much risk does this pose to the citizens? And what is required to lock up the dreaded variant in a bottle? What measures are the relevant authorities taking to mitigate possible spread? Health experts on Good Morning Nigeria will tell us the way out.
And joining us from our Kano studio is the National Incident Manager, Presidential Steering Committee on COVID-19, Dr. Mukhtar Mohammed. Dr. Mukhtar Mohammed is actually on the left-hand side of your screen. Dr. Mukhtar, you're welcome to Good Morning Nigeria, and we would like to commiserate with you on the death of your elder brother. And we're happy you were able to make it this morning to be with us on Good Morning Nigeria. You're welcome.
Thank you, Kingsley. Good morning.
All right. And also with us via Zoom is the Director General of the Institute of Medical Research, Dr. Babatunde Salako. Dr. Salako, it's a pleasure to have you this morning with us on the program.
Very much. Good morning.
All right, and here with us in the Abuja studios is the Acting Secretary, FCT Health and Human Services Secretariat, Dr. Mohammed Kau. Dr. Kau, delighted to have you on Good Morning Nigeria.
Thank you. Okay. Morning, Nigerians.
All right, let's begin the conversation straight away with Dr. Mukhtar Mohammed. I joined my colleague Kirian in also commiserating with you on the loss of your brother. Tell us, I mean, we're hearing about the Delta variant of COVID-19. This is at a time that, from mere observation, Nigerians have obviously let down their guard. Probably we also understand now that it's in the country, and if so, what is the extent of infection and what do we know about hospitalization rate at the moment?
Thank you, Karen. Good morning. The Delta variant actually is a variant of COVID-19 that was first identified in India. And we've seen how devastating, the pandemic has been in that part of the world. And largely it is attributed to this particular variant, which has more transmission rate, it is more transmissible, and also is more virulent and takes more people into hospitals and even into deaths. It has spread to over 90 countries since about 6 months ago now. And it has been growing. It has been responsible for the increasing number of cases in most countries. Wherever it appears in a very short period, it dominates all other strains of COVID-19 or the SARS-CoV-2 virus. And the good thing is that it is still susceptible to most of the vaccines that are being used all over the world. So initially we thought we had this variant in the country, but later confirmation showed that we did not have it in November until the last week sequencing, genomic sequencing, which was done at the reference laboratory in Abuja. We discovered that we have this variant in a traveler who actually came into the country about 2 months ago. So that means that the virus has probably been in circulation for about that period. And it is now beginning to show as we see the rising number of cases. We believe that this is perhaps maybe the beginning of a third wave. And Nigerians and all the authorities need to take extra precaution to ensure that we are able to contain it the earliest possible time.
All right, let's turn to Dr. Babatunde Salako. Dr. Salako, what else do you know about this strain of COVID-19? As the last speaker pointed out, that it started from India, and one wonders how actually it got into Nigeria. And if the story is right, that it came through a traveler, which was just a week ago or thereabouts, how did it get into many persons in Nigeria? Because the report indicates that many Nigerians may have contracted this variant. How did it happen? Was it existing in Nigeria before this traveler was detected? Because that is another aspect. And Nigerians would like to know, again, how dangerous is this variant and what is the best form of combating it?
Thank you very much. As the previous speaker said, the Delta variants originated from India and have traveled from that part of the world to many other countries. And like I often say, that diseases don't need visa to travel. They travel to individual. And so the case that came to Nigeria is a typical example of such. What else that is known about the virus is that the symptoms that come with it, it's a bit different from the usual one. The Delta variant causes more of runny nose, cold-like symptoms, some form of headaches, and sore throats, as compared to what we used to see in the original variant, issues of loss of smell, fever, and cough, and then, of course, breathlessness. So when you see these new symptoms in a patient, you may want to suspect that, although the only way to confirm is to sequence the virus and determine that viral architecture. It's been known to be very contagious, and it spread very fast, much more than what we used to see in the common strains, the original strain from Wuhan. And therefore, it affects a lot of people. As soon as it gets into a community, it spreads very fast and then a lot of people get infected. So you begin to see a rise in the number of infections on a daily basis. And so the one that came to Nigeria, which was sequenced by the NCDC, perhaps, maybe, we don't know yet, responsible for the increase in the number of cases that we are beginning to see. But until we are able to sequence many of the cases, we will not be able to say that, to confirm that. And the NCDC now is upscaling sequencing. Been talking to Lagos State, for example, to provide us with their samples so that we can sequence samples around Lagos. And in the next few days, we'll be coming up with sequencing of about another 100 samples of recent cases. And we will be able to see if indeed we are having a lot of Delta variants among the recent infections that we are beginning to see in Lagos.
Okay, thank you very much, Professor Salako. We will return to you in the course of the conversation. Now back to our Abuja studios. Dr. Mohammed Kawu, who is the Acting Secretary of Health and Human Services in the FCT. Dr. Kawu, tell us, what do we know at this time about the manifestation of Delta variant, or indeed any pre-existing form of COVID-19 in the FCT at this time?
Yeah, thank you so much. Good morning, viewers. As you've heard from earlier speakers, in the FCT, for the past 1 or 2 weeks, we started noticing the positivity rate increasing from almost 0 to about 0.34%. And you recall the Lagos State government has announced it has increased from 1.1 to 6.6. So it means something is happening. And so we became very worried. Thankfully, we have left all our commands and centers fully opened. As we speak, we have 4 patients on admission already. We have 2 in Gwagwalada and 2 in Disdedo. Sadly, last 1 week, we lost 2 patients. One died at National Hospital. The other one died at Disdedo. So, as Prof said, the symptoms this time around are more of upper respiratory tract infections like flu and sore throat, although sore throat is common to almost all the variants. It's not to panic, but I think to get ready as a people and do whatever we need to do. We've noticed in African continent that a lot of countries are going through this the 3rd wave. And so we are prepared, particularly oxygen supply, availability of beds, and medical personnel. So we are getting ready. We pray and hope we won't get into the 3rd wave. But I think most importantly, we need to understand that we're in a very, very, very difficult situation, very dangerous position, seeing what happened in India and other places. So the most important or the best thing to do is to ensure that we protect and prevent the having full-blown 3rd wave using the normal preventive measures that we've been used to. In terms of prevention, there is no difference between the Delta variant or the other variants. The only difference is that this one spreads faster, more vicious, and probably deadlier. But in terms of prevention of getting infection, is those ones. And the other important thing is, all over the world, it is noticed that vaccination prevents people from coming down with the ailment. So I think federal government is really working hard to ensure that we have more vaccines. And we encourage people to, as a matter of urgency, come forward and take these vaccines, because we have noticed very, very serious vaccine hesitancy in the first phase of the vaccination. And don't forget, the first phase was for frontline health workers and strategic leaders. So if you have hesitancy in those kind of people, then we begin to wonder what will happen when we go into the communities and societies. But I think we need to do a lot in terms of mobilization, risk communication, And discounting and telling people all these videos that are being circulated are fake, and they are just destroying the system. Thank you.
Now, from what you have said, did you notice any form of COVID-19 Delta variant in some patients in Abuja so far?
We have not noted that there is no difference from the symptoms we've been seen before now. The people that died, they are all very, very complex and complicated cases. The other one has had end-stage renal failure, and then also have had the COVID-19. So he must have died more of the renal failure. Yes, the same thing with the other gentleman from National Hospital. It's the same very complex and complicated comorbidities. So we're not worried that the deaths were actually because of Delta variant. But we are worried because we know from what has happened all over the world that the Delta variant is more vicious. So we are concerned, and we are getting ready, should in case, God forbid, we get into that. You've seen how India went around concerning oxygen and all those things. So that's what is happening.
Yeah, not just India, Indonesia as well.
Yeah.
But in recent times, Indonesia has been battling with oxygen supply. Let's return to Kano with Dr. Mokhtar Mohammed. Dr. Mokhtar Mohammed, I mean, how does the Presidential Steering Committee react to what we have seen in recent weeks or even in recent months, that Nigerians have practically abandoned just the simple preventive measures, no social distancing, no hand washing, and even the alarm raised by the Lagos State Governor to say that incoming travelers were given fake addresses, and therefore they were untraceable. And it appears also that perhaps the officials who are manning the various locations at the airports probably are not doing what is right. Otherwise, they might have been able to intercept one or two of the carriers of this Delta variant. So how is the Presidential Committee taking a look at this? I mean, through you now as the National Incident Manager.
So as you are aware, the Presidential Steering Committee has actually continued to sensitize Nigerians, to continue to work with all the stakeholders. We are working with partners as well as the state governments. We meet regularly and discuss issues with the states. We have outlined a strategic action plan with them. And we have heightened the state of preparedness and also the state of response, particularly at our points of entry. Let me reiterate that over the last several months, we have recruited more people to work at particularly our airports. We have instituted several measures, including restricting passengers who are coming into Nigeria. We have restricted passengers of certain countries from coming into the country, and unless there is a very strong reason to do that. Our officers have been more vigilant. We have intensified the surveillance at these airports. However, just as you know, with every system, it can have its own weaknesses. But what we know is that in both Lagos and Abuja, which are the major entry points of passengers into Nigeria, we have tightened this surveillance system. Anyone who is coming from these restricted countries must first present a negative COVID-19 result. And if the person presents a fake result or presents any other test other than a PCR test, that person is penalized. And if you're coming from these restricted countries, upon arrival at the airport, information will be given to you, and even pre-departure, you would have read it when you are registering, to come into the country, that you will be taken into mandatory quarantine. We have successfully quarantined over 1,500 passengers since these restrictions started, who are coming from these different countries. Majority of them, of course, in Lagos. FCT is also doing an excellent job trying to identify these people and also trying to enforce this restriction. But like you have seen or you have heard in some of the reports, Nigerians can be very difficult or complicated. A Nigerian who is an elite or holds a very sensitive position will find his way to try to avoid getting into quarantine. And that is where the Presidential Task Force, comes, to ensure that this doesn't happen. Our chairman, the secretary to the government of the Federation, has given us the necessary support to ensure that anybody coming into Nigeria from these countries actually complies with the protocol. We take them into these quarantine facilities with the support of Federal Ministry of Health, in Abuja with FCT Department of Health, and also in Lagos with the Lagos State Ministry of Health. And anybody who violates this protocol, we have serious sanctions. Their passports are suspended, and if they are not Nigerians, they even risk being deported out of the country, because we'll have their visa or resident permit cancelled with immediate effect. So this is the situation. On arrival, you won't be able to know a passenger who has a Delta variant or a passenger who doesn't have. Besides, most of the persons that come into the country, of course, appear healthy. They complete a health questionnaire, which they declare that everything, about their health or contacts, is free of COVID. Then they also have a negative result. And our officers do scrutinize this very thoroughly to ensure that, the passenger actually, the test is actually genuine. And since we started publishing the names of people who have defaulted or who evaded quarantine since the early month of May, the number of people not complying in our facilities has drastically reduced. But we have continued to update this list. We have continued to ensure compliance, and we've continued to sensitize people who come into the country the danger of not doing the quarantine or not doing the COVID-19 test as and when due.
All right, thank you so much. Those measures actually are working, but because of the behavior of viruses that we know globally, now we have the Delta variant we're talking about. And so I'd like to go back to Dr. Salako. Dr. Salako, in the event of widespread of COVID-19 Delta variant, which we do not pray for, is there any specific treatment protocol for this variant? Of course, we already have the Indian experience, but is there any specific protocol for treatment of this particular variant in case, of course, it finds its route in Nigeria?
Thank you very much. There is no specific treatment protocol. So far, what's been shown to be effective is vaccination, and that is what we should pay particular attention to. I believe this is an opportunity for us as a country to fast track the purchase of vaccine for Nigerians, even though we know there are some kind of vaccine apathy, but there are quite a number of people who have been asking for vaccine. I believe the 4 million that we have must have been exhausted by now. So for us to prepare for the likely event of Delta variants in Nigeria, we must necessarily vaccinate as many people as possible. And the other thing is the provision of oxygen to isolation centers. And as far as I know, federal government has supported quite a number of isolation centers in the second wave to purchase oxygen plant and install these in their centers. So if in the event that we require a lot of oxygen, these centers will be able to provide oxygen for the treatment of those patients. More importantly is that we have to start looking at our social mobility. That is in the realm of NCDC to determine when certain protocols in terms of movement around will be brought into place, because the only way for us to reduce the spread is to look at that. And then, of course, there is a lot of inappropriate use of the PPIs now. Campaigns should begin in earnest to remind Nigerians that we have in our country the dangerous variants, and if it has to, or if it does become a dominant strain in Nigeria, then we are going to have a lot of cases. For us to prevent that, people have to go back to the use of those PPIs and prevent the spread. But like I said, I think the major thing we should be doing is vaccinating our people. I am also aware that the Federal Ministry of Health is doing a lot to get into the country vaccine, especially the Johnson & Johnson. And through some other eminent Nigerians that I'm also aware of, the Federal Ministry of Health is trying to begin the production of COVID-19 vaccines in Nigeria in collaboration with the private company, the BioVaccine Nigeria Limited, which is supported by federal government and run by Mayor and Baker. There are talks ongoing to fast track this process, even though it may not come in a few months. But then, given the fact that COVID-19 will be with us for quite some time, it will be necessary for us to fast track that process so that we can begin to produce our own vaccine in Nigeria, to at least begin to vaccinate our people, and before we move on to other countries of the West African sub-region. Thank you.
All right, thank you very much, Professor Salako. Now back to Dr. Mohammed Kawu. Dr. Kawu, while we're still on the subject matter of vaccination, what was the response of FCT residents to the vaccination scheme 1 that obviously has come to a close now? And the federal government, of course, is seeking to procure some 40 million doses of vaccines. How did the FCT residents respond to this? Were they part of the anti-vaxxers and circulating all kinds of misleading information via social media?
Thank you very much. Yes, we had some form of resistance in the FCT, especially in the early part of the first phase. But eventually, people came and we've exhausted all our vaccines. As you may be aware, the vaccination, the first phase has closed, was it some 2 or 3 days ago across the country. We have closed our own on the 5th of this month. We've vaccinated, fully vaccinated over 100,000, which is just a small fraction of the population. The most important thing is that we have vaccinated large number of our frontline health workers who are very, very key and very, very important because, as you may know that should in case we have the wave, they are the ones that are going to come around and manage the cases. So more than 90% of our healthcare workers have been vaccinated fully. And also a lot of strategic leaders and some elites have been vaccinated. But certainly we have resistance in the communities. And we have to do a lot when we get the vaccine eventually. As Doctor has said, vaccination is the most important thing when it comes to this. We must ensure that we get to the herd immunity status And that's why you see some Western countries are trying to open up because they are vaccinating a lot of their population. But I think we vaccinated less than 2% or so, and that is very abysmal. So there have been resistance of vaccination in FCT and across the whole country.
I'm wondering, Dr. Muhtar Mohammed, tell us, what was the effect, if any, of the vaccination in the first phase? Because I'm sure you must also have encountered some of those stories circulated on the social media about the negative effects of vaccination. Oh, some persons said, oh, either persons were going to die or they had died, X, Y, Z. What negative effect did we record in the 2 million plus Nigerians who were vaccinated in the first scheme?
And so that you can also take on this, the aspect of the stories making the rounds on the social media, is that in 2 years, anybody who was vaccinated is going to have an issue with antibody activities in the system. They may eventually damage people's organs. That's also part of what people are circulating.
Certainly, there are a lot of fake news going around, not only limited to Nigeria, but I think globally. You have people who have dedicated their lives to spreading lies and fake news about things that they don't know. They are not researchers, they are not scientists, and they churn out this information. You wonder what is the basis of doing that. For us in Nigeria here, yes, certainly, there are groups of people who have somewhat believe in those claims, and they tried to propagate it. But what I tell them, and what we try to do, is to actually discountenance that, and to let Nigerians know that it's only people who are experts in that field that can give us that opinion. How can you sitting in your room or somewhere and just say that 2 years from now people are going to die or people are going to develop these things? These things have been studied. Yes, we agree that the vaccine was produced in a rush, but look at it. The vaccine that we have, we didn't say that it prevents against infection, and it doesn't even prevent from spreading the disease. It prevents the individual from getting hospital admission, from getting severe disease. And we have seen that demonstrated in most countries where this vaccination has been rooted very well. The hospitalization rate among the elderly in the UK actually declined to almost zero. You don't have elderly, particularly those living in elderly homes, presenting with COVID symptoms or getting admitted again. The mortality has reduced. These are facts. So I think really Nigerians need to be smart to understand that you just can't believe any news. We've seen so many fake videos going around and viral, and they don't even deserve a long discussion or even recognizing them or giving them a platform to be able to propagate it, because they are just pure bunch of lies. So in terms of specific things that we have done, yes, we have intensified our risk communication. Yes, as Dr. Kau mentioned, there was some significant level of hesitancy in the community. What we did was we engaged with religious leaders, with traditional leaders, and also through various platforms, to encourage Nigerians and to provide the information there that these vaccines are safe and they are effective, based on what we have seen in other countries and based on the utilization we have recorded so far. We have not recorded any significant number of serious side effects, and even the ones that have been seen are largely due to perhaps other conditions or other existing conditions than just the effect of vaccination itself in isolation. So there is nothing you can do. You can take a horse to the river, but you can't force it to drink. We're doing our job, to ensure that we have intensified risk communication, sensitization, and communication, and to ensure that as many Nigerians become aware of the facts, and we also try, to counteract any fake news or any misinformation that is being peddled out in the public.
And some Nigerians are also making choices, in terms of the vaccine to be administered. Some say they prefer the Pfizer product, some AstraZeneca, of course, which is the vaccine that is being administered in Nigeria at the moment. Some are saying, look, I am waiting for Johnson & Johnson, which is just one shot. So what actually is the difference in terms of the efficacy of these vaccines? Is there any difference? Is there any one more efficacious than the other? Why are people making choices of the type of vaccine to take? And again, what type are we expecting to come in? Because of course other volumes are being expected to come into Nigeria.
The efficacy of vaccines is something that is scientifically established. You look at the people who have been vaccinated and find out the proportion of them that came down with the disease, and you compare them with those who did not come down with the disease. As you vaccinate more people, you gather more data. At the beginning, we had this difference based on the manufacturer's information that some vaccines had more efficacy than others. But now with mass vaccination going on, I tell you that most of the vaccines have kind of equalized. They all have efficacy of more than 92%, which is really good. Some, the efficacy has increased to 98%. Even the Oxford AstraZeneca that, earlier on was said to have an efficacy of 68% with the first dose, now has an efficacy of about 90 or 92%. So certainly there are slight differences, but I tell you, when you don't have enough, the option that is available is the best option to take, because this is a race against time. If we have all the options available in the country, then people can be picky or choosy about which vaccines they want. But when we don't have, when these vaccines are not available, the wisest thing that anyone can do is to take the vaccines that are available. Certainly, people have preferences. Some people say they don't want to be injected twice. They want Johnson & Johnson. But during the time of wait, you don't know when that is going to be available. Anything can happen. You can get infected, and you can be so unlucky to be among the few, who can be hospitalized or gets the severe form of infection. Regarding your second question, yes, we are communicating through the NPHCDA and the Federal Ministry of Health with COVAX facility, and with also other mechanisms where we're expecting some amounts of vaccine to arrive the country, perhaps towards the end of this month. That is what we've been promised. But we know that this global vaccine politics or vaccine nationalism has hampered the distribution, and has actually not been fair to developing countries, because we do not have the power, the resources, to be able to compete adequately and to get these vaccines. So federal government is intensifying effort. Certainly, we are going to get some doses of Johnson & Johnson. We've been promised that also we are going to get some few million doses of even the Pfizer vaccine. And the NPHCDA is actually strategically planning on how, the guidelines that we'll provide to take in all the options of the vaccines that become available in the country.
All right, thank you very much, Dr. Mukhtar Mohammed. Professor Babatunde Salako, what can we learn from the Indian experience? India is said to host the largest manufacturing enterprise of vaccines in the world. And yet, we saw how once the devastation of COVID-19 swept through the country, persons started disposing of their gods, small gods and idols, because they said those small gods and idols couldn't save them. So what happened? You know, in India, you produce vaccines, and at some point, you know, they even placed an embargo on vaccine exports, as well as export of other medicines. So what can we learn from them in this whole effort, you know, to contain the ravages of COVID-19, whether of Delta variant or other variants?
Well, I believe that what happened in India was that there was that misconception that COVID-19 was not severe in their country any longer. And the fact that they were producing vaccines and they were giving their people vaccines. And so they seemed to let loose their guard, and a lot of social mobility occurred. Several festivities and social gathering started. And that was what provided opportunity for the mutation of the COVID-19 virus to develop the Delta variant. When infection continues within a particular community, it provides opportunity for the virus to continue to mutate. And in doing so, there may be some significant mutation, like the Delta mutations, that then led to the virus being more severe, more contagious, and spread faster than the original virus. That was what happened. Now, the fact that people who are vaccinated does not prevent the individual from getting infected. What the vaccine does is to prevent you from getting severe disease or from dying from the disease. And so in that situation, the new virus ravaged the country, and then it spread from there to other parts of the country. I think the simple lesson here is for us to begin to look at our social mobility and monitor the spread of the Delta variants in Nigeria by doing a lot more sequencing that we have been doing. And we have more, at least about 3 or 4 centers now in Nigeria doing sequencing. What is required is support to ensure that these centers are able to sequence the new cases that we are having in Nigeria, so that we can determine if we have the spread of the Delta variant in Nigeria. And we also need to pursue the sequencing beyond just Delta variant, because we are also beginning to talk about Delta Plus, which is a variant of interest. We don't know yet if it's going to be as bad as the Delta variant itself. And so if you have more infection in a country, the only way to do surveillance is to do sequencing to determine if there are other variants that may come up because of frequent infection. So having said that, we have to get back to the COVID-19 protocol that the steering committee has always been talking about, and the NCDC guideline also prevention of infection. And this has to be, go back to the level at which we had it in the first and second wave, so that Nigerians can be more aware of the danger of the Delta variants in our community, and the fact that if they do not use the protocol, they are likely to assist in the spread of infection. Again, we have to come back to vaccination, which appears now to the whole world the only way to control the pandemic.
All right, sir. Let me take you on the last issue you mentioned, which has to do with the vaccine. I'm just worried about the fact that here we have vaccines, vaccines that cannot prevent you from getting a disease. Could that be because these vaccines were manufactured in a rush, as pointed out by our guest in Kano? what else can the world scientists do to ensure that the efficacy of these vaccines increase to a point where anybody who has it will not get the disease in the first place? Because I am also worried about the continuation of the spread of COVID-19 and mutations that could continue for years to come. If anybody vaccinated can as well get this disease, when can we totally eradicate this disease? If that is the situation at the moment globally with respect to vaccines.
Getting infected has to do with coming in contact with the virus. The vaccine will not prevent you from coming in contact with the virus. What will prevent you from coming in contact with the virus are the protocols, the use of the NPIs that everybody has been told. And this is something that we are not doing. So we are going to continue to come in contact with the virus, and the virus will certainly infect us. The advantage of the vaccine is to produce already in your body soldiers that will fight the infection if it comes to your body. So that's what the vaccine does. It's only us that can prevent getting infected by one, washing hands, use of sanitizers, use of face mask to prevent droplets from people who have been infected to others who are not. And then, of course, social distancing. These are common things, but there are behavioral changes in the society that a lot of people are not able to keep up with. And we must just continue to do that campaign as much as possible to get large majority of Nigerians to imbibe that so that we can reduce contact and reduce the spread of infection. Now, having been vaccinated now puts you at an advantage so that if you, for any reason, get in contact with the virus, you are unlikely to die from the infection. And until we are able to vaccinate a large majority of people, which is regarded as herd immunity, 70–80% of the population, that will then prevent the vaccine from infecting a lot more people, so that it does not transmit to a lot more people. But until we get to that point, we have to continue to use these MPIs, and people must necessarily fall in line to ensure that we do not spread infection among ourselves within the community. Even where people have completed vaccination, we're talking about efficacy. Some people have what they call breakthrough infection. We are following up a number of people from our institute, and we found that about 3 people have breakthrough infection. That is, after having 2 doses of AstraZeneca vaccine, they still got infected and they are symptomatic. What we're doing now is to sequence the virus and determine whether this is a new strain or whether this is Delta strain, because Delta strain has been shown to reduce neutralization by the vaccine to some extent, even though it is still very effective against it. But to some extent, there are some of the infections that are not able to, it's not able to take care of. And this is something that we have to look at, whether this will require people having booster doses. Already, even the Pfizer maker are already talking about booster doses in the US because of breakthrough infection. These are new things that we need to look at critically to be able to determine whether this is a one-shot vaccine or a vaccine that will require yearly or 2-yearly booster doses until scientists are able to find a permanent solution to this.
All right, thank you very much, Professor Babatunde Salako. Well, one of the last points you made, we'll take it up with regard to the talk about a 3rd dose for those who already have 2 doses of the vaccine, like AstraZeneca, or I think it's Moderna also, that they also take 2 doses in the US. And people are asking, when will there be an end to multiple vaccinations against one single virus? It's Good Morning Nigeria, live on the network service of the Nigerian Television Authority. We're taking a short break now. When we return, we'll continue with the conversation. You're welcome back to Good Morning Nigeria on the network service of the Nigerian Television Authority. Dr. Mohammed Kawu, who's with us in the Abuja studios. Just before we went to that short break, I would say, look, there is talk already about a potential third dose. This is more of what we hear from advanced countries where they've had a wider vaccination scheme in their respective entities. Is this something within our contemplation or within the contemplation of the scientific community in the first instance? And more particularly, what does the vaccine do to you?
Thank you very much. I think this is very important for everybody to understand. And that is also causing the vaccine hesitancy. Now, if I'm vaccinated, I should throw my face mask and enjoy myself and interact anyhow. Now, what vaccine does is that there are 3 stages of infection. You come in contact with the germ, in this case, COVID-19 virus. It enters your system, that is, you are infected. Now, it brings you down with symptoms and signs of the disease. All vaccines, what they do is they make you develop immunity. They make you develop defense mechanism against the offending organism. And that is what happens in all vaccinations. Now, if you are able to get to herd immunity, either through vaccination or through allowing the system to take care of itself, everybody gets vaccinated, get infected and develop natural antibodies until you get to herd immunity. When you get to herd immunity, where more than 80% of the population have defense in their system, so the virus cannot move or thrive because everybody has defense. So that's what people need to understand. Whether you are vaccinated or not, we still have to ensure that we go with the non-pharmaceutical preventive measures until we get to a level where a majority of us are vaccinated. Now, we've been also having breakthrough infections in just 1-2% of people that have completed vaccination and they still come down with some symptoms. Normally, these symptoms are not as bad as if you are not vaccinated. So it's a novel virus, it's a novel disease, and a lot of research is ongoing in terms of all these ones. The other issue I want to discuss is issue of people coming into this country from the red zones of the world, India, Brazil, Turkey, and recently South Africa. They are aware of the protocol of mandatory quarantine in a government-approved institution, be it hotel, hostel, or whatever. But most Nigerians don't want to do this quarantine. And what they need to know is they are first of all endangering their families first. Because if you're allowed to go into your home, the first people you come in contact are your aged parents, relations, and you get them infected. Government had put in place that you get quarantined for 7 days. On your day 2, you get tested. And day 6 or day 7 before you leave, you get tested. If you are negative, you are free to go into the society. But a lot of people are resisting. We are having a lot of resistance. Even when you take them to the quarantine centers, they don't stay in their rooms. They come out, start mingling in the hotels. So it's like issue of enforcing the social distancing, the wearing of face masks. Can government get police to hotels and start forcing people to obey? So I think we must take personal responsibilities as Nigerians. What government did is to try to prevent infections such as Delta variants from coming to the country. That's all we're trying to do. And this you can only do by obeying the public health rules and regulations. And it's not only in Nigeria, it's all over the world.
When you get quarantined, who bears the bill?
They bear the bill. Government cannot, of course, afford to quarantine everybody coming to the country. But what we do is we have categories of hotels, depending on your status, your financial standing.
Do you have to quarantine those who also have been vaccinated in the countries where they're coming from?
Of course, the protocol that anybody coming into this country must come with a negative PCR result from any country.
What is the validity of that PCR result? Because I know that a place like Holland, even if you are a transit passenger through Amsterdam, your PCR result must not be older than 24 hours.
See,
how many hours do we admit here?
72 hours, you must have 72 hours before you board. You must do a test 72 hours before you board an aircraft. Now, you see, we are trying to narrow the window of getting infected. Because if you get infected, before you manifest, before it's detected in your body, it takes roughly 72 hours. So each country is trying to narrow that window. Because even at the transit, you can get infected. And that's why even in the aircraft, you can get infected. So if you got infected 3 days earlier, it's different from if you got infected just in the aircraft. Are you getting me? So we do day 2 and day 7, trying to ensure that you don't escape you identified as having infected.
Okay, Dr. Carl, thanks. Kieran, I want to go to Dr. Mukhtar.
Exactly.
Yeah, I don't know what question you have, but Dr. Mine is still on vaccines and vaccination, Kieran. Dr. Mukhtar, well, all 3 guests have underscored the importance of vaccination in the fight against this virus. Well, we have already exhausted the first 4 million or so, 3.98 million doses that we got free of charge. Are we still relying on donated vaccines to continue the next round of vaccination, or are we as a country now going to make purchases?
Certainly, both plans are on their way. As you know, that the donated vaccines come through the COVAX facility, which is really a global push towards supporting developing countries to have access to the vaccine and to have equity in the distribution. So certainly, we're expecting some more doses through that facility. Secondly, Nigeria has just budgeted some amount of money that will be used, to procure these vaccines. So we are going to put our funds there. We are going to augment the COVAX facility so that we are not only getting in the line, but we also move faster on the line to be able to have access to these vaccines. We're also looking at the option of doing bilateral discussions with many of these developed countries and also with the manufacturers of the vaccines. This has already started. And once the money is made available, then we'll get on the queue. We'll know when we are going to get these doses. The problem with the vaccine politics that is currently being played out is that countries that are rich, countries that have access to these manufacturers, or countries that control what these manufacturers do because they are located in their countries or they have access, to how, the management works, ensure that, they get the first doses first. So you have countries who have gotten more than enough doses of the vaccine that they need for their population. So there is apprehension, there is fear that is driving the scarcity of the vaccines. The current discussion going on globally is to try to ensure that, we don't really over-politicize this vaccination issue. This is a health issue. You are not safe in your country until everybody else is safe in another country. Now, take, for example, countries that have reached 60% vaccination or whatever. They are now trying to move through using vaccination cards and whatever. Now, we will not accept that for now, because the fact that they have been vaccinated means that they have just been prevented from getting hospital admission to getting the severe form of the disease. As you heard from my colleagues, that they can still spread the disease. They have the infection, so when they come into the country where our immunization coverage is low, they can fastly, spread that infection and get more people to be infected in the country. And that is why we ensure that we have this quarantine policy. Even if you are vaccinated, before you come into the country, you must show us a negative test result within 72 hours, as Dr. Kau mentioned. And after arrival, if you are from the red listed countries, you must go into the quarantine, the mandatory quarantine, for 7 days, because you can still be having the virus, in your upper respiratory tract, and you sneeze, you cough, you spread it out in the public. So it is good for you. You've been vaccinated. You will not come down sick, but it is not good for the people you come into contact with, because you can spread the infection to them.
All right. Thank you indeed, Dr. Mukhtar Mohammed. Let's return to Dr. Salako. Dr. Salako, already the Delta variant is here with us in Nigeria. It's been reported in Oyo State and as well as Lagos. And there is a possibility of this variant, being spread all over Nigeria. So the question is, what are the steps to be taken at this very initial time? What are the steps to be taken to ensure that this variant does not spread across Nigeria?
Thank you very much. The first thing is to upscale our surveillance of cases and monitor the variants. And of course, the next thing to do will be to prepare for a third wave that may arise from the Delta spread. And that means that all isolation centers that have been closed should be reopened, get prepared in terms of equipment and staff, get test kits ready in case we have a deluge of number of patients to be tested to determine the cases and be able to take care of them in the isolation center. The issue of vaccines have been mentioned over and over again. We cannot overemphasize that. And oxygen is something that is very important. Again, isolation centers should begin to look at their oxygen plants to make sure that they are optimal and they can produce large amounts of oxygen on a daily basis. And more importantly is to talk about awareness, risk communication, the use of non-pharmacological intervention. And for our frontliners, the use of PPIs to prevent infection amongst them. Social mobilization or social mobility is also very important. In as much as we don't want to do any lockdown without threat of severe infection from Delta variants, we must begin to look at that and monitor closely to be able to determine at the appropriate time when we may want to ask people to stay at home, or when we may want to reduce the number of people that are going to be attending public functions. I know some of these things are in some states, but then we have to look at the festivities that are coming. The fact that a lot of people are going to be gathering together, there has to be a lot of movement around. While we may not start crying without seeing what makes us to cry, we must also get ready to make sure that we don't allow some of these social movement around, especially during the festivity, to be the harbinger of the spread of Delta variants. inappropriate use of non-pharmacological interventions. We have mentioned we must continue to talk to people to make sure that this is real and remind them of the countries where this has happened, India and Brazil. We're not trying to scare people or make them feel that there's plenty of, danger ahead. But then we have to tell the truth, looking at the examples of those countries. We don't want such things to happen in our country. And it is in our hands, the hands of the community leaders, the gatekeepers have to continue to talk to their people, the religious leaders. We have to go back to the awareness campaign, just as we did to bring down the first and the second wave, so that we can begin to prevent the third wave before it starts.
Well, Professor Salako, I still want to stay with you. It's been suggested that part of the ineffectiveness of our risk communication efforts with regard to COVID-19 in general, whether of the Delta or otherwise, has arisen from the view that appears to also have gained currency amongst many Nigerians, that, well, coronavirus now is going to be with us like any other disease, common cold, but more particularly like HIV, which in earlier years was predicted to be a harbinger of mass death. That many people have not died, from HIV, and people are still living with it. And so corona is virtually the same way. So that when you go to urban locations such as Lagos, Abuja, and elsewhere, there's little observance these days of the non-pharmaceutical measures. So is corona likely to be like HIV that you just live with if you it just becomes, as some Nigerians would say, a matter of luck? You get it, it's your funeral.
I believe that what has happened in Nigeria is that we have had experience in tackling some recurrent outbreaks in the past, the Lassa, the yellow fever, the experience with Ebola, and the fact that we have a National Public Health Institute that knows what it's doing, the NCDC, and the leadership of the NCDC, the MPHCDA, all of whom have worked together to ensure risk communication, even at the lowest, at the grassroots, because these are areas where they have been working over the years. So it was easy for them to jump on that platform and through that, do their risk communication. And where they needed to do vaccination, like the one we just completed, there wasn't much of a problem because we had a platform, we have the experience. I think that has been very effective. And that is one of the reasons why we don't seem to have seen the kind of ravaging disease that we saw in other places. Although there are other theories of sunlight in relation to calcium levels in the body and things like that. But then we cannot and we should not throw away the fact that we've gone through this road before in the area of Lassa, which we see every year, and we're able to use our experience in field epidemiology to stall the spread of the disease. Then the disease itself, 80% of it is mild. And so we have a lot of people within the community who have had contact with the virus and have indeed developed antibodies to the virus. Although the antibodies have been shown to wane at about 8 to 9 months. So we cannot think that as it is now, because we have some community infection and because we have been vaccinating a small number of people, we are getting protected. No. Until we are able to get 70–80% of our population vaccinated, getting to herd immunity, we may not rest on our oars. Therefore, the issue of risk communication has to be a continuous one. And this has to be through both the electronic and the print medias, the religious houses, and of course, at the community levels, the garages, you know, every areas where we have opportunity of talking to a large number of people. This will be more effective as much as we do not have enough vaccine in our country yet.
All right. From all indications and from all our guests have said, it appears that really we may have to live with this virus for a longer time.
Yes, sir.
Obviously, because the vaccines in question, yes, are good, and many people are not, of course, they're not interested in the vaccine, and the vaccine itself is not 100%. And because of a mutation of this virus, then there may be, we may have many years to go with this virus. We are not praying for that, but that's what the situation is becoming based on analysis of experts who have had a Good Morning Nigeria and other programs. And now, Dr. Kau, what is the level of preparedness of the FCT in case of outbreak of COVID-19 Delta variant in the city?
Yeah, thank you so much. I think we have not dismantled anything from the second wave. So the two most important isolation centers on ground, the Idu, where we have about 500 beds. In fact, we have piped oxygen to Idu Treatment Center. And we have established a high-density area where you can manage severe cases. DZDOM, about 300 beds, is also in place. In fact, we have staff there. I told you we have 2 patients on admission. The Gwagwalada, University of Abuja Teaching Hospital Gwagwalada, they have migrated to their NCDC established infectious disease wing. So we have also revamped, rehabilitated our oxygen plant in Asokoro Hospital. We have been given an oxygen plant in Maitama Hospital, and you are aware federal government has also given about 37 oxygen plants across the country, and they are all almost in place. So the health personnel have been trained. They have been sent back to the hospitals, working in the normal hospitals. However, if we need them anytime, we will call them. So we are really prepared. God forbid, should we have the third wave. Yes.
Okay. All right, Dr. Kawut, thank you very much. Dr. Mokhtar Mohammed, I would like you to be very brief on this because we are now flying on borrowed time, as it were. Look, you know, imitation is a very strong human behavior. Those who watched Euro 2020 saw various stadia crowded with tens of thousands of spectators, most, if not virtually all of them, without masks. In the US, they're having a wonderful summer. You know, people are out there in a number of cases, no mask. In a few days' time, you're going to be having the kickoff of the Tokyo Olympics. On the 19th of this month, the UK is saying, look, all our lockdown measures or measures relating to the prevention of COVID-19 will be lifted. People are going to be asking themselves this question. I mean, if this is happening elsewhere around the world, how come we are still talking about being careful about either the Delta variant or even COVID-19 in our environment?
So let's not be economical with the truth. There are things that happened in the US and UK, particularly regarding vaccination. The UK has about 65 to 68% of the population receiving at least 1 dose of the vaccine, and they have over 50% who have received the second dose of the vaccines. Therefore, to some extent, they are confident that a great number of their population have been vaccinated. When you have reached herd immunity, What it means is that even if there is introduction of a new infection into your community, you will be able to brace it up, because most of your people will not come down with severe disease, they will not get hospitalized, and most likely they will not die from the disease. But that is not what is happening in Nigeria and most of the African countries and even other middle and low income countries of the world. Because we have not vaccinated any significant number of the population. For Nigeria, our vaccine coverage is just 1%. We just vaccinated with 2 million doses, 2 million persons in the country. And therefore, any new infection can prove to be a calamity in the country. So we are not on the same pedestal, we are not on the same standard, and we should not make that comparison. Now, they are opening up, you know, and that is really the reason. But for us, this is the time to be even more circumspect and to be even more careful. Because number one, we have noted that during the first and second waves of COVID-19, it actually coincided when there was a huge volume of international travelers coming into the country. It coincides with the holiday period when schools in UK and other countries have closed, so you have the students coming back into our country. You have people, you know, who have traveled out either on vacation or whatever and are coming back into the country, and it coincided. You know, you remember the second wave was around January, December, January. That's when we saw the wave to be gathering momentum. And now, this July, we know that schools are going to close in the UK too. So even though they might have been vaccinated or half vaccinated, when they come into this country, you know, it can be a threat because they...
So, Mukhtar Mohammed, in fact, we appreciate the valid points that you are making. We're not of the same standard with the developed nations with respect to the extent to which vaccines, you know, have been administered on people. But at that point, we'd like to thank you for being part of our program this morning. And once again, we commiserate with you on the death of your elder brother. Thank you indeed for coming on the show this morning. We also like to thank Dr. Kawu Mohammed, who is the Acting Secretary, FCT Health and Human Services Secretariat. We appreciate your contributions. Dr. Babatunde Sarako, we also appreciate you of the Nigerian Institute of Medical Research, the DG of that institute. We thank you indeed for being part of our program this morning.
All right, so that's Good Morning Nigeria for today and indeed for the week. We hope you enjoy your weekend. Do take care, learn lessons from this program. We're back on Monday, same time, 7 in the morning. Until then, I'm Kingsley Osadola.
And I am Kirian. You might learn to protect yourself.
I'm sorry, Kirian. I was saying I'm sorry. Tomorrow is Friday. The program is back tomorrow, Friday. I think the rains have actually altered my perception of the day.